Our last speaker in the first session here is Mary Brindle. Mary is a pediatric surgeon and a health systems researcher. She's the incoming director of the Safe Surgery, Safe Systems program here at Ariadne Labs, and we're delighted to have Mary join us on July 1st. She is right now the director for the Providence of Alberta's Surgery Strategic Care Network and a professor of surgery at the University of Calgary. Mary's presentation is titled Managing and Navigating Safe Systems Through COVID-19. Mary?
Thank you. So during the pandemic, our Safe Surgery and Safe System team has had to pivot to address the challenges COVID poses to our health system. Next slide, please. The graph on the left illustrates the value of flattening the curve to prevent a surge in patients from overwhelming our health system. This is likely very familiar to everyone who's on the line, and keeping the peak number of cases below our system capacity has really been the goal of many public health measures. Yet despite these efforts, the curve in many of our centers has looked a little bit more like the red curve on the right side of the screen, where the peak is higher and broader than we would like. Although public health measures are the cornerstone of our response, certainly increasing our system's capacity is also absolutely essential. And much of the time when we think about this increased capacity, we think of it in terms of hospital beds and ventilators and concrete things like that, but this ignores really our most important resource during COVID, the human resource. Next slide, please. Our team, supported by the Argosy Foundation grant, has a three-pronged approach to addressing the human resource demands during COVID. And these include identifying the characteristics of rapid, effective, and safe redeployment for health systems as a first aim. As a second aim, identifying the characteristics of rapid, effective, and safe onboarding for individuals. And as a third aim, creating and testing tools and implementation guidance that can be used to address future human resource needs during COVID and other healthcare crises. So I'll present the pilot results for our first aim that consist of interviews of health system leaders in which we explore the strategies that have been used for human resource redeployment. Last slide, please. So the following themes arose during 7 interviews that were performed across 5 different sites in 4 countries. And these 8 themes are as follows. Number 1, that systems are required to understand where their needs might be and have a response to that so they could proactively anticipate these. Number 2, that we must be aware of our sources of human resources so that we can tap them when they're required during a surge. Number 3, we must cultivate and activate on-the-ground leadership. And number 4, the communication is going to be a cornerstone of our approach, and they're needed to address fears and provide information and be provided frequently and in a timely fashion. Number 5, we should support the deployed staff with local training and local mentorship. And number 6, despite the urgent need of human resources during health crises such as COVID, we still need to pay attention to credentialing checks and good onboarding. Number 7, although trainees may be redeployed during a crisis like COVID, promotion of these trainees to staff is rarely considered, and they're certainly a bit of a vulnerable population in our response and have to be considered that way. And I think number 8, and finally, at the heart of all of this, the focus must remain on patient safety and staff well-being. And I think that was a theme that really came up quite frequently during our interviews. I'd welcome any questions now. Thank you very much.
So Mary, this is great. Thank you so much. You know, one of the questions, as we think about Ariadne and our basic arc, you're very much in the design phase here. You're learning from others, and the goal is ultimately to create a tool that could then be used. And so I'm curious what you think about what will the prototype of that tool look like, and how could that be then tested?
I think it's a really good question. And I think it's one of the difficulties when you're trying to design a tool in the middle of a health crisis itself, to recognize that it has to be very adaptable. And I think that's one of the first elements of the tool that we have to recognize, that whatever we create at the beginning may not look like the tool that we eventually might be using towards the end of a crisis like COVID. The other thing is that the tool itself is going to need to be usable by the health systems approach, but kind of as I illustrated in that the curve and the flattening of the curve, that the intersection between public health and the health systems itself has to be part of it. So I think that what this will need to be is it will need to be a simple tool that is able to pull up available data very quickly in order to anticipate need, as well as to quickly evaluate available resources, and that those can be adapted by centers that are looking to develop a quick response. So I'd say that the data is going to be needed, but also that flexibility.
All right, thank you so much.